How much do you pay for your whole family's health insurance per year? I know your company might have covered it all, but what price would you put on a human's life per year? Well, according to the health data from USA, it's $7,000. That's the average yearly cost on health insurance if nothing bad happens to your health. Today, based on my true medical story in USA and Taiwan healthcare system, I want to share with you and tell you why health insurance is a scam in the US and how it works like a big puzzle where the pieces don't fit right.
Ms. Holmes, please raise your right hand.
Elizabeth Holmes taking her last steps of freedom.
In the US, the average family spend more than 25% of their income on health insurance, or the same equivalent of their salary if their company pays the bill. As of today, the US is the only developed country on the earth without universal healthcare. If you're not familiar with the basics of universal healthcare, so essentially it is lower the barrier for medical support and trying to cover the cost for most people through the tax they pay. But in USA, we pay both heavy tax plus very high insurance cost. So you may wonder, what's the big deal? Didn't the insurance company partner up with the hospitals already so they can lower the cost for every one of us? Let's give some examples. Well, in Canada, a vial of insulin costs around $30, but in the United States, the same medication made in the same factory costs 10 times as much as in 300 USD. In Australia, the HIV drug Truvada costs $8, but in the USA, well, it's $2,000. The USA spends more on healthcare than any other country, but is not the best at taking care of people's health. Even with all this money spent, people still have to pay a lot for their medical care. Big companies that focus on making money control this system. They charge too much money and they care a lot more about the profits than to help people. The high cost of healthcare is such a massive problem. It's estimated 2/3 of all personal bankruptcies in the US are tied to the family's medical expenses, which amounts to 500,000 families going bankrupt each year. People are very scared of getting sick, and more like people are more scared to see their medical bills after the treatment. So you may ask, why doesn't the US government offer free healthcare? It's something a lot of people would think might be basic, right? It's because most big companies control things for their own benefit, especially the health insurance companies and pharmaceutical companies. Why? Here's how it works. The health insurance companies say they help you to save money by getting a special and lower prices from hospitals. But this isn't really true. They've actually made deals with hospitals to make it look like their insurance is a great deal. But for a long time, nobody would ever know what the real difference is between the real price and the price under an insurance policy. So people had to trust what the insurance company said. For example, let's say at one hospital, a medical test colonoscopy costs around $782 for someone without insurance. But if you had insurance, it will cost over $2,000, almost 3 times in there. And at the University of Pennsylvania hospital, a pregnancy test costs only 10 USD without insurance, but with insurance, it costs nearly $100. So even with health insurance, we don't really care about how big of the price is because we think the insurance company covered all because of the premium we pay for all those insurance companies. The reason behind why we're not sensitive to these prices are because, we are not the end payers for those bills, but eventually who paid for the insurance companies? It's made up by massive amount of premiums that's paid by us. So it turns out that people with insurance company often pay more than if they had no insurance at all. So the biggest secret is that insurance companies make it look like they're giving you a big discount, but they aren't. They just start with really high prices. So this tricks people into thinking that they're getting a really good deal when they're not. For more financial literacy and more insightful interpretation to news, policies, regulations, please stick with my channel.